Hi, I'm Dr. Manon. I'm a holistic physician working with women over 45. And today I want to talk about something that has been bothering me for a very long time. Because for years as a chiropractor, I had women coming into my office that were in their 20s, 30s, early 40s, bent over in pain, with pelvic pain or back pain or both. And this pain was disrupting their work, their relationships, their ability to function in their life. And many didn't even know why at first, which is why they came to me in the first place. Later on, they find that they have a diagnosis of polycystic ovary disease, or PCOS, or endometriosis. And these women weren't just dealing with pain. They were dealing with a medical system that was truly failing them because nobody ever looked for the root cause. They were treated with things like hormone suppression therapy, birth control pills, pain medications, and many, unfortunately, become surgical candidates because none of these approaches ever dealt with the real problem. Now, chiropractic helped with the pain, and it's natural, but I always knew that we were managing symptoms of something much deeper that nobody was addressing. Now, fast forward to today, and I now work specifically in hormone health, and those same women, or women just like them, are now in my practice, hitting perimenopause and menopause, and their experience is often more difficult than the average menopause because nobody ever found the true cause of that problem. And that's what this video is about. Hope to give you some solutions here. So what I want to play out over and over again, and maybe you'll recognize your own story. A woman in her late 20s or 30s finally gets diagnosed with endometriosis, and according to the research, it often takes 7 to 10 years from her first symptom to get a proper diagnosis. 7 to 10 years of being told she just has difficult periods. Then it gets so much worse that the first line of treatment can be surgery, laparoscopic excision or ablation to remove the lesions inside. And here's what the research shows about that surgery. Within 2 years, 20 to 30% of women have full symptomatic recurrence. Within 5 years, 40 to 50%, and then for more advanced stage endometriosis, up to 67% recurrence within a 5-year period. And still, nobody has looked for the true cause. So many of these women are put on the hormone suppression therapy or medications that push their body into a medically induced menopause in their early 30s, 40s, and this is just to manage the condition. And through all of this, not one conversation about her gut. Not one conversation about why her immune system is so dysregulated that it is allowing tissue to grow where it shouldn't. Not one conversation about what is happening or not happening in the gut microbiome. The same story plays out with PCOS. Different drugs, different symptoms being managed, but the same untouched root cause. I watched this for years and it truly broke my heart. Now women who sought care with me and other natural health providers fare a little bit better. They may have been recommended anti-inflammatory diets, low glycemic eating patterns, progesterone therapy, things like Vitex, curcumin, pelvic floor work. Research supports all of this, and they all help. So why are these women still struggling when it comes to menopause? Because every single one of these interventions is being done in isolation. And rarely does anyone, even the natural doctor, look at the gut as the central hub where all of these systems connect. And it's like hiring 5 contractors to fix a house. They may all be great at the job they were hired to do, like one for the cracked walls, one for the leaking roof, one for the warped floors. But what will be accomplished in the long run if the root cause was the foundation? And no one was ever checking that. So the foundation for PCOS, endometriosis, and estrogen dominance is the gut. It's specifically called the estrobolome. And until that is addressed as part of a truly holistic protocol, everything else will only give partial incomplete relief. So here is what the research is now confirming. Women with endometriosis show significantly higher rates of intestinal permeability, called leaky gut, compared to women without the condition. Now, leaky gut triggers systemic inflammation, and endometriosis is fundamentally an inflammatory condition, and it's fueled by the gut. For PCOS, a 2024 study in Frontiers of Microbiology found that women with PCOS consistently show lower microbial diversity and a disrupted estrobolome, that gut bacteria that's responsible for metabolizing estrogen. And this drives the condition. So researchers now recognize that it is the gut imbalance that drives the hormonal imbalance, which causes the symptoms, which further disrupts the gut. And this is a vicious cycle with no end if it's not addressed properly. So for estrogen dominant symptoms like fibrocystic breasts, weight gain, heavier than normal periods, the mechanism is very direct. When the estrobolome is disrupted, the liver packages estrogen for elimination, and the gut then sends it right back into the bloodstream. And chronically elevated estrogen suppresses progesterone, and that's the exact environment that allows endometriosis to thrive and PCOS to worsen. And that's why we now know these are not three separate conditions with three separate causes. They're actually three expressions of the same underlying dysfunction, a disrupted gut that's driving a disrupted hormonal system. Unfortunately, since no one is addressing the root cause of the gut, we continue to eat and do all the things that continue to worsen the microbiome, such as things like taking medications like NSAIDs, pain relievers, and antibiotics, eating a low-fiber and processed food diet, often too much sugar. So many of us reach perimenopause and menopause in this very disturbed state. And then what happens? Our estrogen and progesterone naturally decline and plummet, often sharply. And for a woman with a healthy gut, that drop, it's manageable. It may be difficult, but it's not the same as for someone who has spent 10, 15, 20 years with an unaddressed gut dysbiosis and that estrogen dominance. Menopause is a completely different experience for these women. So research shows that the gut microbiome shift at menopause is dramatic on its own, and the result is what I see in many of my clients, then hot flashes that are severe and relentless, weight gain that doesn't respond to any traditional methods, brain fog so thick that women tell me they feel like they're losing their minds and they're disconnected between the brain and the body. And then anxiety can be very severe, disruption of sleep, joint pain, depression. And these women are told again and again that this is just menopause and that it's normal. And often they'll give them antidepressants or HRT and tell them basically live with it. But the HRT may help for a while, but it can actually drive it. So the unaddressed root cause reaches a tipping point, and I want to say something directly to every woman watching this now. You're not being weak, it's not about willpower, and you're not imagining it. Your body has been fighting this battle for a very long time, and nobody gave you the right tools. So let's end that now by looking at what actually addresses this problem in a more holistic way so that you can get to the root cause and finally be rid of it. So number one, the gut, as we've been talking about. So targeted strain-specific probiotics that restore the estrobolome. So this includes specific strains of Lactobacillus, Bifidobacterium, Saccharomyces boulardii, which I put up on the screen that I'm not going to go into each one, but there are some companies that now create blends of these specific for this purpose. Number two, gut lining repair with quercetin and zinc carnosine to seal the permeability driving the inflammation. and then adding prebiotic fiber to your diet to feed and sustain that beneficial bacteria. Everything else builds on this foundation. All right, 3, identifying which hormones specifically are out of balance for you, because PCOS looks different from endometriosis and estrogen dominance. They all have a little bit different drivers depending on your individual picture. So progesterone support may be indicated, liver support to ensure proper estrogen clearance. Number 4, anti-inflammatory nutrition in your diet and supplements. Supplementation with curcumin, omega-3s, and anti-inflammatory nutrition are not replacement for the gut healing we discussed, but they're partners to it, and they're part of this holistic picture. So together, the results can be dramatic and different than just doing one alone. Then the nervous system. Chronic pain and chronic hormone disruption dysregulate your nervous system deeply. You need to have pelvic floor work, movement like exercise, stress reduction really earn their place here. Not as the primary intervention, but definitely an essential support, especially for a body that's been in survival mode for far too long. And this is what holistic actually means. Not 5 separate practitioners, each doing one piece, but one integrated approach that treats the root and lets the branches heal. So the bottom line is, if you've been living with PCOS or endometriosis, or if you're now in menopause and your experience, and it's a lot harder than you think it should be when you look at other women, there is a reason, and there is a path forward that goes deeper than anything you've been offered before. So what I recommend, the first step for women watching this video, is understanding exactly which hormones are driving your specific symptoms, because that does change everything about how we approach this together. So I've created a free hormone anti-aging quiz that identifies your top 2 hormone imbalances based on your symptoms. And it takes just a few minutes, and once you complete it, my team will personally reach out to walk you through your results and your next steps, whether that's working with me one-on-one or joining our holistic hormone school community. So you will finally have a real integrated starting point. And the link is in the description and in the pinned comments. If this video resonated with you, please like and subscribe and share it with someone else. There is a woman in your life who has been told her pain is normal and her suffering is just menopause, and she may need to hear this. So I'll see you in the next video. Namaste.